Health experts have been sounding the alarm for those participating in protests to still take precautions relating to the pandemic that we're still in. Senior health correspondent Monica Robbins explains how a new study shows prevention methods actually can make a really big difference in risk.
As thousands shout for justice and equality, those on the front lines of the COVID-19 pandemic cringe when they see protesters not protecting themselves. They fear mass gatherings like these may spawn a second wave of infection. Now, a new study is backing up their fears. It shows keeping your distance can lower your risk to just 3%. The same for wearing a face mask. And eye protection can lower risk to just 6%. Face shields and goggles are great for health care, but a pair of regular or sunglasses may remind you to keep your fingers out of your eyes. These measures are not complete protection, so hand washing is still critical. Dr. Amy Acton and others say this is especially important for those in African American communities, as Ohio numbers are showing.
We do see disparities in our data that are showing that this is affecting our African American citizens and people of color disproportionately to their representation in the population.
For those who already have or those who will continue demonstrating, health officials are asking that they get tested if possible. They also suggest using signs and noisemakers instead of chanting to prevent the spread of droplets. Keep 6 feet apart at all times, and afterward, stay away from others and monitor for potential symptoms for 14 days.
And here in Cleveland, it was great to see the majority of people participating in those protests were wearing masks. But the physical distancing is very important, too. And the state case numbers have been flat lately. But if the protests cause a second wave of infections, Laura, will likely see that by the end of this month. Monica Robbins, 3 News.
Some important things to remember, Monica. Thank you so much.